Again, an amazing crowd here this morning. We've counted over 300 of you coming out here. How many of you came out here of your own free will? Well, wait, the White House says these are phony crowds, that you're being paid, you're being bussed in. Is that true? I'll tell you what, I've got a next individual. She's amazing. She and her husband are inside the healthcare industry. She's been limping along this trail with us. She has taken time off of work to be a part of this tour. This entire tour is funded by you. It is donor driven. There is no big corporate money behind it, in spite of what the left-leaning media tells you. We appreciate your support. Now I've got Renee Elmer's coming up. Renee's going to share her insights with you. Thank you.
Thank you, Chad. Yeah, I was telling someone earlier that it actually feels pretty comfortable out here for me. Now, I know you all are in the sun, but you know, yesterday when we were in Jacksonville, the sun was beating down on us, and that's pretty much how it's been every day. And I said, you know, if we had big insurance companies paying for this, we would be in nice, cool conference rooms and hotels. We would not be out here standing in the heat doing this. I am a nurse. My name is Renee Elmers. I'm a registered nurse, and I work in Dunn, North Carolina, which is in Harnett County. I work with my husband, who is a general surgeon. Now, my husband has been on the tour a couple of times as well, and had to leave us on Thursday because, you know what, he had to go to work and take care of patients and save lives and do the things that we really need to be doing, not being out here talking to you all. We need to be helping people. But I feel very strongly about this issue, and I'm primarily here to clear up a few misconceptions that unfortunately our government is putting out there about how healthcare feels about this. Now, I'm a nurse. Are there any healthcare professionals here? Nurses, doctors, respiratory therapists, any of you? Bless you, and thank you for coming out and being a part of this. What government is saying right now, and some of our government leaders have said that overwhelmingly doctors and nurses are on board with this. That is not true, and I am here to tell you that. I have spoken with the nurses, I have spoken with doctors. They are very concerned. We are very afraid of how this is going to affect the ability to treat patients. You know, we all know the saying, when you have your health, you have everything. And anyone who is taking care of a sick family member or has been sick themselves knows that life stops when you're in the middle of an illness or you've had surgery or something like that. My friends, I'm here to tell you that our government wants to take that everything from you. We have the best healthcare system in the world. We need to defend it, because if it goes, we will never get it back again. And government wants to control your lives from preconception to death. Now, another issue out there is that apparently the AMA has come out and said that they are in support of this. Now, that's the American Medical Association. However, they only represent less than 30% of physicians practicing in the United States. The North Carolina Medical Association has raised concerns about the Obamacare plan. The American Surgical Association has serious issues with this health care plan. Now, we've all heard about Rahm Emanuel. Well, Rahm Emanuel has a brother, and he is an advisor to our president. He is a doctor, but he's not a practicing physician. He is raising concerns about the Hippocratic Oath that all physicians take when they become doctors. Now, the Hippocratic Oath is based on the philosophy of Hippocrates, which basically honors life from conception to death and says that doctors will do no harm. Obviously, they are feeling that the Hippocratic Oath is going to get in the way of what they're planning to do. You know, things like the Constitution get in the way of the things that they're wanting to do. Now, I told you that my husband was with us for a short time. He is a general surgeon. And on behalf of my husband, I would like to tell you, and he would tell you if he were here with you right now, that he does not want a government bureaucrat standing in between you and him in the examination room. Thank you.